H. pylori, what is that?
H. pylori is a bacteria that is transmitted from food. You swallow it, you get the infection in your stomach. If you start getting symptoms and it makes an ulcer from the intense inflammation, that can eventually lead to stomach cancer if untreated.
How is it treated?
It's treated with 2 antibiotics and what's called a proton pump inhibitor.
An example of that would be?
Amoxicillin is one antibiotic that can be used for almost all ages. The second antibiotic is usually something like Biaxin, clarithromycin, or Zithromax. And the third proton pump inhibitor, which is extremely important, would be something like Prevacid, Omeprazole, Prilosec, Protonix, Acifex, Nexium. The proton pump inhibitor is extremely important because it prevents the infection from leaving the stomach cells, and the infection has to die off in those cells.
And the length of treatment, it's usually how many days?
It's usually 2 weeks for the antibiotics and at least a month for the proton pump inhibitor, because in 2 weeks you can kill the amount that's on the surface of the stomach, and the proton pump inhibitor prevents anything else from coming out and dying. Now, another very important thing, locally for symptoms, bismuth, Pepto-Bismol, is extremely helpful, because if you needed to go to a 4th medicine to add to eliminate this, bismuth also kills off H. pylori.